Cardiac dysrhythmia. Introduction. Cardiac dysrhythmia, also referred to as an arrhythmia, is a condition in which the heart beats irregularly, too fast, too slow, or with an abnormal rhythm. It occurs due to disturbances in the electrical conduction system of the heart, which is responsible for maintaining a steady heartbeat. Some dysrhythmias may be harmless, while others can be life-threatening, leading to complications such as stroke, heart failure, or sudden cardiac arrest. Early diagnosis and appropriate management are essential in preventing severe outcomes. Definition. According to the American Heart Association, AHA, cardiac arrhythmia is an abnormal rhythm of the heart, which can affect its ability to pump blood efficiently. According to the World Health Organization, WHO, a disorder of heart rate or rhythm due to improper electrical impulses regulating the heartbeat. Normal electrical conduction system of the heart. The heart's rhythm is controlled by an electrical conduction system that ensures coordinated contraction and relaxation of the heart chambers. The key components of this system include sinoatrial, SA, node, the natural pacemaker of the heart, located in the right atrium. It generates electrical impulses at a normal rate of 60 to 100 beats per minute, BPM. Atrioventricular, AV, node, acts as a relay station that slows down electrical impulses before transmitting them to the ventricles, allowing time for the atria to contract and push blood into the ventricles. Bundle of His, a collection of specialized fibers that transmit electrical signals from the AV node to the ventricles. Right and left bundle branches carry electrical impulses to the respective ventricles, ensuring synchronized contraction. Purkinje fibers spread the electrical impulse through the ventricular walls, leading to a forceful contraction that pumps blood into the lungs and the rest of the body. Types of cardiac dysrhythmias. 1. Based on heart rate. Bradyarrhythmias, slow heart rate, 60 BPM. Sinus bradycardia. 6. Sinus syndrome. Heart block, 1st, 2nd, 3rd degree. Tachyarrhythmias, fast heart rate, greater than 100 BPM. Sinus tachycardia. Supraventricular tachycardia, SVT. Atrial fibrillation, a-fib. Atrial flutter. Ventricular tachycardia, VT. Ventricular fibrillation, v-fib. 2. Based on origin of dysrhythmia. Supraventricular dysrhythmias, above the ventricles, atria or AV node. Sinus node dysfunction, bradycardia, tachycardia. Atrial premature complexes, APCs. Atrial flutter. Atrial fibrillation. Paroxysmal supraventricular tachycardia, PSVT. Ventricular dysrhythmias, originate in ventricles. Premature ventricular contractions, PVCs. Ventricular tachycardia, VT. Ventricular fibrillation, VF. Tours de points. 3. Based on conduction disturbance. Heart blocks. 1st degree AV block, prolonged PR interval. 2nd degree AV block, type 1, Wenckebach, type 2, Mobitz 2. 3rd degree AV block, complete block. Bundle branch blocks, BBB. Right bundle branch block, RBBB. Left bundle branch block, LBBB. 4. Based on regularity of rhythm. Regular dysrhythmias, example sinus tachycardia, sinus bradycardia, atrial flutter. Irregular dysrhythmias, example atrial fibrillation, multifocal atrial tachycardia. Etiology. Cardiac dysrhythmias can occur due to various factors that disrupt the normal electrical activity of the heart. 1. Cardiac causes. Coronary artery disease, blockage of blood supply to the heart. Myocardial infarction, heart attack. Heart failure. Cardiomyopathy, disease of the heart muscle. Valvular heart disease, abnormalities of heart valves. 2. Non-cardiac causes. Electrolyte imbalances, low potassium, hypokalemia, high potassium, hyperkalemia, low calcium, hypocalcemia, and magnesium abnormalities. Hormonal disorders, hyperthyroidism or hypothyroidism can affect heart rate. Medications, beta blockers, diuretics, digitalis toxicity, or stimulants, example caffeine, nicotine. Drug and alcohol abuse, cocaine, amphetamines, and excessive alcohol consumption. Stress and anxiety can trigger palpitations and abnormal rhythms. 3 congenital causes. Genetic mutations affecting heart conduction. Congenital heart defects present at birth. Pathophysiology. Abnormal electrical activity in the heart. Down arrow. Disruption of normal impulse generation in the SA node or other pacemakers. Down arrow. Irregular impulse conduction through the atria and ventricles. Down arrow. Development of arrhythmias, example bradycardia, tachycardia, fibrillation. Down arrow. Ineffective atrial or ventricular contractions leading to reduced cardiac output. Down arrow. Decreased blood perfusion to vital organs, brain, heart, lungs, kidneys. Down arrow. Symptoms such as palpitations, dizziness, syncope, chest pain, and dyspnea. Down arrow. Risk of thrombus formation in atrial fibrillation, possible stroke or embolism. Down arrow. Potential complications like heart failure, myocardial ischemia, or sudden cardiac arrest. Clinical manifestations. Palpitations, feeling of a racing or irregular heartbeat. Dizziness or lightheadedness. Syncope, fainting. Shortness of breath. Chest pain or discomfort. Fatigue and weakness. Anxiety or restlessness. Diagnostic evaluation. 1 history taking. Chief complaints, palpitations, dizziness, syncope, chest pain, fatigue, shortness of breath. Onset and duration, sudden or gradual onset, intermittent or persistent episodes. Precipitating factors, stress, caffeine, alcohol, medications, physical exertion, electrolyte imbalances. Associated symptoms, sweating, lightheadedness, fainting, confusion, weakness. Past medical history, hypertension, coronary artery disease, previous myocardial infarction, heart failure, diabetes, thyroid disorders. Family history, sudden cardiac death, congenital heart disease, arrhythmias. Medication history, use of beta blockers, antiarrhythmic drugs, diuretics, stimulants. Lifestyle factors, smoking, alcohol use, recreational drug use, diet, physical activity levels. 2 physical examination. General appearance, anxiety, restlessness, pallor, cyanosis, sweating. Vital signs. Heart rate, bradycardia, tachycardia, irregular rhythm. Blood pressure, hypotension or hypertension. Respiratory rate, tachypnea, dyspnea. Oxygen saturation levels. Cardiac examination. Palpation, irregular pulse, pulse deficit. Auscultation, irregular heart sounds, extra heart sounds, S3, S4, murmurs. Jugular venous distension, JVD indicating heart failure or increased right atrial pressure. Respiratory examination, crackles or rowels in case of heart failure. Neurological examination, assess for confusion, dizziness, or syncope due to decreased cerebral perfusion. 3 specific tests and procedures. Electrocardiography, ECG/EKG. 12-lead ECG, identifies the type of dysrhythmia, example atrial fibrillation, ventricular tachycardia. Holter monitor, 24-48-hour continuous ECG recording for intermittent arrhythmias. Event recorder, used for long-term monitoring when symptoms occur infrequently. Exercise stress test, evaluates dysrhythmias triggered by exertion. Electrophysiology study, EPS invasive test to map electrical activity and locate arrhythmia origin. Laboratory tests. Serum electrolytes, K, Na, Ca superscript 2, Mg superscript 2 imbalances can trigger dysrhythmias. Cardiac enzymes, troponin, CKMB to rule out myocardial infarction. Thyroid function tests, TSH, T3, T4 hyperthyroidism or hypothyroidism can cause arrhythmias. Arterial blood gas, ABG, analysis, to assess oxygenation and acid-base imbalances. Imaging studies. Echocardiography, evaluates structural heart diseases and ejection fraction. Chest X-ray, detects cardiomegaly, pulmonary congestion. Cardiac MRI or CT scan, used for detailed heart structure and function assessment. Medical management. 1. Pharmacological treatment. Antiarrhythmic drugs. Class I, sodium channel blockers, lidocaine, flecainide. Class II, beta blockers, metoprolol, propranolol. Class III, potassium channel blockers, amiodarone, sotalol. Class IV, calcium channel blockers, verapamil, diltiazem. Other medications. Anticoagulants, warfarin, apazaban, to prevent stroke in atrial fibrillation. Digoxin, slows heart rate in AF. Surgical management. Pacemaker implantation. Used for bradyarrhythmias, example sinus node dysfunction, heart block. A small device implanted under the skin sends electrical impulses to regulate heart rate. Types. Single chamber pacemaker, stimulates one chamber of the heart. Dual chamber pacemaker, coordinates atrial and ventricular contractions. Biventricular pacemaker, for heart failure patients with dysynchronous contractions. Implantable cardioverter defibrillator, ICD. Used for life-threatening ventricular dysrhythmias, example ventricular fibrillation, ventricular tachycardia. Continuously monitors heart rhythm and delivers shocks when necessary to restore normal rhythm. Catheter ablation. Minimally invasive procedure using radiofrequency or cryotherapy to destroy abnormal electrical pathways in the heart. Indicated for atrial fibrillation, atrial flutter, supraventricular tachycardia, SVT, and some ventricular arrhythmias. Maze procedure. Surgical treatment for atrial fibrillation. Small incisions or ablations are made in the atria to create a maze of scar tissue, disrupting abnormal electrical circuits. Performed as open heart surgery or minimally invasive procedure. Coronary artery bypass grafting, CABG. Indicated if dysrhythmia is due to underlying coronary artery disease. Improves blood flow to the heart by bypassing blocked arteries, reducing ischemia-induced arrhythmias. Left atrial appendage closure, LAAC. For atrial fibrillation patients at high risk of stroke. Devices like the Watchman implant are used to close the left atrial appendage, preventing blood clot formation. Heart transplantation. Considered for end-stage heart failure patients with severe, refractory arrhythmias. Involves replacing the diseased heart with a donor heart. Nursing management. 1. Decreased cardiac output related to altered electrical conduction of the heart. Interventions. Monitor heart rate, rhythm, and blood pressure regularly. Assess for symptoms of decreased perfusion, example dizziness, hypotension, pallor. Administer antiarrhythmic medications as prescribed, example amiodarone, beta blockers. Maintain access for emergency drug administration. Monitor electrolyte levels, potassium, magnesium, calcium, to prevent further dysrhythmias. Educate the patient on lifestyle modifications, such as avoiding caffeine and stress management. 2. Ineffective tissue perfusion related to inadequate cardiac pumping function. Interventions. Assess peripheral pulses, capillary refill time, and skin temperature. Monitor oxygen saturation and provide supplemental oxygen if needed. Position the patient in a semi-Fowler's position to promote circulation. Encourage deep breathing exercises to improve oxygenation. Prepare for emergency interventions such as defibrillation or cardioversion if necessary. 3. Risk for impaired gas exchange related to decreased oxygen delivery due to dysrhythmia. Interventions. Monitor respiratory rate and effort, and assess for signs of hypoxia, cyanosis, confusion. Administer oxygen therapy as prescribed. Encourage coughing and deep breathing exercises to prevent respiratory complications. Monitor arterial blood gases, ABGs, to assess oxygenation status. Collaborate with respiratory therapy for further interventions if needed. 4. Activity intolerance related to inadequate cardiac function. Interventions. Assess the patient's tolerance to activity and monitor for signs of fatigue or dyspnea. Encourage bed rest during episodes of dysrhythmia to reduce cardiac workload. Gradually increase activity levels as tolerated with proper rest periods. Educate the patient on energy conservation techniques and avoiding strenuous activities. 5. Anxiety related to fear of life-threatening cardiac event. Interventions. Provide emotional support and reassurance to the patient and family. Explain the condition, treatment plan, and procedures in simple terms. Encourage relaxation techniques such as deep breathing and meditation. Offer psychological counseling or support groups if needed. 6. Risk for injury related to syncope or sudden cardiac arrest. Interventions. Implement fall precautions, such as keeping the bed in a low position and assisting with ambulation. Monitor the patient closely for signs of syncope or dizziness. Educate the patient and family on emergency response actions, such as CPR. Ensure emergency equipment, defibrillator, oxygen, is readily available in case of cardiac arrest. 7. Knowledge deficit related to lack of understanding about cardiac dysrhythmia and its management. Interventions. Educate the patient about the importance of medication adherence. Teach dietary modifications, including reducing sodium and caffeine intake. Provide information on recognizing symptoms that require immediate medical attention. Encourage follow-up visits and regular ECG monitoring. Prevention. 1. Lifestyle modifications. Healthy diet, low salt, low fat, high potassium and magnesium. Limit caffeine, alcohol, and nicotine. Regular exercise, moderate aerobic activity. Weight management, prevent obesity-related heart stress. Adequate sleep, 7 to 9 hours per night. Stress management, yoga, meditation, relaxation techniques. 2. Controlling risk factors and medical conditions. Manage hypertension, regular monitoring, antihypertensives. Control diabetes, diet, exercise, medications. Treat thyroid disorders, thyroid hormone regulation. Manage coronary artery disease, statins, lifestyle changes. Avoid arrhythmia-inducing medications, decongestants, stimulants. 3. Prevention of complications, secondary prevention. Medication adherence, antiarrhythmic drugs, beta blockers, anticoagulants. Regular cardiac monitoring, ECG, Holter monitoring, event recorders. Use of pacemakers for bradyarrhythmias. ICDs for high-risk patients, ventricular fibrillation, tachycardia. Catheter ablation for recurrent dysrhythmias. Complications. Stroke, due to clot formation in atrial fibrillation. Heart failure, due to inefficient pumping. Sudden cardiac arrest, especially in ventricular fibrillation. Cardiogenic shock, severe hypotension due to arrhythmia. Conclusion. Cardiac dysrhythmias are significant heart rhythm disorders that can impact cardiovascular health and overall well-being. Early detection, appropriate treatment, and lifestyle modifications play a crucial role in preventing complications and improving patient outcomes.